Hi, I'm Dr. Jeffery P. Schoonover, owner and Chief Medical Director of Indiana Vein Specialists. I want to thank you for joining us today to review the state-of-the-art treatment of varicose vein disease. It is estimated that over 80 million patients may be affected by the spectrum of venous disorders. This can range from the small spider veins all the way up to large caliber, ropey varicose veins. Varicose veins are the larger dilated, often symptomatic veins that you can clearly see on the skin surface. Our goal at Indiana Vein Specialists is to provide an individualized treatment plan for our patients. For most patients that experience large, ropey varicose veins, their saphenous veins are often the source of the problem. The saphenous veins have a series of valves that keep the blood from going backwards. For people that have varicose vein disease, these valves go bad. One of the main reasons is actually based on heredity. Usually there's a family member that has some component of varicose vein disease. Other factors can play a role too. The type of occupation you have, especially if it's in a standing position for most of the day. We know that pregnancy and the hormonal fluctuations associated with menopause can also trigger varicose vein disease. During the evaluation and treatment process here at Indiana Vein Specialists, we start off with a history and extensive physical exam to document the extent of your varicose vein disease and the impact on your daily activities. Our next step is to use this tool called diagnostic ultrasound mapping. We're using ultrasound technology to identify the branches and the sources of the venous reflux. Let's walk through the steps of this process. When we bring a patient into the room, we actually have to clean the leg. This is a type of surgical prep solution that we use to help keep a clean environment to access the vein. Once we have the vein accessed with the help of ultrasound, a small guide wire is placed into the saphenous vein. A catheter is then slipped over the guide wire and positioned. Once that catheter is in position, we can actually do a series of numbing injections along the course of the abnormal refluxing vein. Once we have confirmed the placement of the catheter, we actually introduce the laser fiber. The laser fiber and the catheter become one unit. We then can activate the laser. But before we do that step, we will all wear laser goggles. It is a medical laser, and that's one of our safety protocols here at Indiana Vein Specialists. Once the laser is activated, this delivers heat to the abnormal vein wall, essentially sealing it shut. The body will then reroute to normal segments based on this. Our room is set up specifically so you can see the treatment as much as you want or as little as you want. At the end of the procedure, we cover the entry site with a couple of steri strips and a small piece of gauze. Compression stockings are then applied. This process usually takes approximately 30 minutes. We see our patients back at around 3 to 7 days later, just to make sure that the leg is healing fine, and we also do a follow-up ultrasound at that stage. Discomfort is usually minimal. For some folks, they may need to take ibuprofen or naproxen post-procedure. We can get you up and walking right afterwards, and returning to work can happen that day. We typically require compression stockings to be worn for 5 to 7 days post-procedure. The initial day of the procedure, we do request the stockings are worn overnight. After that, just during the day for 6 to 8 hours. For patients that have symptomatic varicose vein disease, most insurers do cover endovenous laser treatment. Our staff here at Indiana Vein Specialists will help you go through your insurance benefits and determine coverage so there are no surprises prior to treatment. Thank you for taking the time to review the endovenous laser procedure with us today. If you have additional questions, please call us at 317-348-3020 or our website at www.indiveins.com.